Good morning, everyone, and welcome to Global Health Uncensored, where we cut through the noise and engage the real voices shaping health systems, leadership, and the future of global health. I'm your host, Dr. Banda Khalifa. Today, we have a truly remarkable guest, Dr. Frieden, who is one of the most influential public health leaders of our time. Dr. Frieden is a physician, global health leader, and an epidemiologist who has spent more than 40 years on the front lines of protecting health. He served as director of the U.S. Center for Disease Control and Prevention for almost a decade, and as a commissioner of the New York City Health Department, where he led landmark initiatives. He's now the president and CEO of Resolve to Save Lives, a global health organization working with countries worldwide to prevent epidemics and reduce cardiovascular disease. Dr. Frieden has been described by many as one of the most influential public health leaders. His leadership has helped save tens of millions of lives, and his work has shaped how governments and institutions think about prevention, preparedness, and the systems that keep us safe. And now in his new book, The Formula for Better Health, How to Save Millions of Lives, including your own, Dr. Frieden distills 4 decades of experience into clear, actionable roadmap for individuals, communities, and governments. The book is already the #1 new release on Amazon. In this exclusive episode, we will trace Dr. Frieden's journey from clinician to global health leader and the leadership lessons that endure. We'll tackle the biggest issue in front of us, what's failing global health today, and we'll unpack his new book, The Formula for Better Health, and its practical framework for saving millions of lives. Dr. Frieden, it's an honor to have you on this podcast. Welcome to Global Health Uncensored.
Dr. Khalifa, it's an honor to have this conversation with you, and I'm looking forward to what we discuss.
Yeah, so I usually like to go back to your origin story so that at least most of my viewers who are early career professionals, who are even some back in medical school, will learn what it takes to achieve such a monumental achievement. So in my first encounter, I would like you to walk us through what drew you to public health and what moments made you realize that, saving lives isn't only about clinical medicine, but also systems, politics, and survival.
Early on, I think I was still in college. I was hiking with my father in the mountains, the Blue Ridge Mountains of Virginia. And my father was the biggest influence on my life. He was a wonderful cardiologist, kind and gentle, thoughtful. And he commented that I seemed to like policy and political issues, and I seemed to like science. And that when you combine those two things, you get public health. I had never heard the term public health before. And that was kind of the beginning of thinking that I might want to go into public health. I also had a first job. It was actually between college and medical school. I was appointed to work for a group called the Appalachian Student Health Coalition, which was run out of the Center for Health Services at Vanderbilt University in Tennessee. And I was assigned to a health center in rural West Tennessee in the extended Mississippi Delta area. And I tell the story in the book, but to cut to the chase, the health center was beautiful. It was a gleaming new building, and the community was just astonishingly poor. People were still living on dirt floor tar shacks. I had never seen poverty like that in the U.S., and yet the building was empty. People weren't coming in. So I did a rigorous study. I didn't know how to do studies back then, but I did a rigorous study. I did a simple random sample, which nobody does, but I didn't know any better. And I interviewed a random sample, truly random sample of nearly 350 households. And what I found was half of the people didn't know the clinic existed. 80% didn't know that it had a sliding fee scale, and if you didn't have much money, you wouldn't have to pay very much. Essentially, nobody knew that it had a van that would take you to and from. And what's more, the people who knew were the people who didn't need to know. They were more socially mobile, less in need. So that really taught me that communication is never as good as you think it is. Yeah. And it's not enough to have health services. You have to have health services that engage with the community.
Awesome, awesome. I think this is a very enlightening moment for you to kind of decide which career path you'll be taking as you move along your clinical training. And I know you also became New York City's health commissioner shortly after probably 9/11, one of the worst catastrophes of our lifetime. What were some of the hardest lessons about leading in a moment like this, especially in the forefront of public health trauma and, at a time where trusts were all under siege?
One of the issues was the importance of being scientifically rigorous. Obviously, the World Trade Center created massive problems, physical and psychological. And there was a mandate and a willingness to support people whose lives were upended by these terrible attacks. At the same time, it's not a blank check, and you have to be able to say, what are the conditions that are proven to be associated with exposure, and to be able to change that over time as we learn more. So this was really a connection of really good science with really responsible public policy to say, if this cancer or lung disease is demonstrated to be associated with World Trade Center exposure, then people will get access to health care and compensation. If it's not, it may be a terrible tragedy, but if it's not related, it may sound heartless, but it's not at least something that the World Trade Center funding should support. In order to do that, we had to enroll the largest registry ever created, more than 400,000 people with exposures to the World Trade Center collapse, and then establish a means to connect with them and track them for decades. So this was an enormous challenge and a balancing act between being compassionate but also scientifically justifiable. I think a second big challenge was seeing past the apparent problems, huge dust clouds, huge problems in the environment, to the problems that are most deadly. And this, to anticipate a later part of our conversation, this really anticipates the formula for better health. It's an approach that's been proven to save millions of lives, and you can summarize it by 3 phases. See, believe, create. See the invisible, believe that what might seem inevitable can be changed, and then work together to create a healthier future. And part of the C was seeing what was really toxic, but may not be so apparent. That included smoking in New York City restaurants and bars, which was quite deadly and quite harmful for the people who worked there and the other customers, but had been accepted as something that couldn't be changed. So I think part of the problem was to address this very apparent, very traumatic situation compassionately and rigorously, but part of the problem was balancing things that were in the headlines with things that were invisible but killing lots of people.
Yeah, I can only imagine how tough you had to make those decisions, especially at that moment in time. And I also know that you've led crisis beyond just that catastrophe. You were you were the director at the US CDC, so you have fairly an amount of experience also dealing with infectious diseases, from Ebola to H1N1. You've led through crisis after crisis. What would you say were some of the most agonizing decisions you had to make whilst you were at the US CDC? And what did it teach you about leadership under pressure?
I think perhaps I don't know if it's hard, but just stressful, is the need for speed. And government systems aren't geared for speed. When I joined CDC a long time ago, in 1990, as an epidemic intelligence service officer, we were told that if a state or country requests assistance, you will be on a plane before the sun goes down that same day, or someone else will be. And that kind of urgent response, whether it's a visit or a response to a request by phone or Zoom or email, that's really important. In an epidemic, time is lives. And what we found in Ebola was that we were getting further and further behind. We were collecting too cumbersome information. We were trying too complex interventions, and we weren't keeping up with the virus. And until the speed got better, we couldn't get ahead of it. And there were a few interventions that allowed us to move with speed. One was using an incident management system framework. For example, in Lagos, Nigeria, the scariest moment of my time at CDC, when we could have had a horribly explosive spread of Ebola throughout Lagos, throughout Nigeria, throughout Africa, that could have continued for months or years and could have killed tens or hundreds of thousands of people, not just from Ebola, but because Ebola shuts health systems from malaria and childbirth and pneumonia and other things. And that was really close to getting out of control, but because the Nigerian government identified effective leadership and used an incident management system, they were able to rapidly get control. But I think the most agonizing things were seeing huge problems coming or spreading and not being able to galvanize action fast enough to deal with it.
Yes, and I think this is truly a very important element in even pandemic preparedness, especially in developing countries, when you talk about speed and how a lot of bureaucratic procedures impede that strategy. And you've been at the government sector and now leading a non-profit, Resolve to Save Lives, which is doing an amazing work in and out of the US. How different would you say is steering a non-profit versus a government agency when life systems and politics are still on the line?
They're all important. You'll never get rapid progress throughout an entire society without the public sector in the lead. But civil society organizations really can make a big difference. They can advocate, they can support, they can identify ways forward. At Resolve to Save Lives, we work on the world's deadliest problems, and we partner with communities and countries to co-create solutions that can be scaled up to address those deadliest problems, whether it's epidemic prevention with things like the 717 timeliness metric that helps countries continuously improve their response, or getting rid of artificial trans fat, something that countries, more than 50 countries have done, that's protecting more than 4 billion people and will prevent nearly 10 million deaths from heart attacks. So I think the really satisfying thing about non-governmental organizations, or at least about Resolve to Save Lives specifically, is our ability to be nimble, to work quickly, and also to try things. You know, in the government sector, if you try something and fail, you're worried that you're going to get blamed. In a non-governmental organization, we might try 3 or 4 approaches before we find one that works. The 717 metric, as an example, 7 days to find every outbreak, 1 day to report to public health, 7 days to have all control measures in place. That was the 3rd or 4th attempt we had at a useful timeliness metric. And that one really works. It's now being used by up to 50 countries. It's been adopted by the World Health Organization, the World Bank, the Pandemic Fund, the Global Fund, and others. But more importantly, it's helping to accelerate, increase accountability, and increase advocacy for strengthening what is fundamentally public health infrastructure to keep us all safe. So the value of a nonprofit organization is to be able to prototype and try out different things, and then to prove they can be scaled, and then to partner with the public sector, with governments and international organizations to scale them up and sustain them for the long term.
Awesome. I think like we've in my line of work, we come across the 717 frameworks most of the time, especially at the WHO, where I'm currently serving as advisor to the Epidemic Preparedness and Response Technical Advisory Group, and I think it's a wonderful framework. So for many young professionals, and even for graduate students in our public health institutions who are seeing the inspiration from your work, what skill sets or mindsets would you say matter most if they want to lead, not even within their communities, but they want to extend that leadership on a global scale?
I think the three most important skill sets are, first, data analysis. You have to be able to look at a complicated problem and try to get deeply into what does the data actually show. And this is complicated. I discuss it in my book, The Formula for Better Health. What is technical rigor? And it's not necessarily randomized controlled trials. I'm a tuberculosis control specialist. That's my background. The first RCTs were done on tuberculosis. We know how to treat tuberculosis because of fantastic RCTs done around the world. So I love RCTs, but they're not always the best way to study every question. And it's really important to understand that. They are the best way to study some questions, but not all questions. So understanding data analysis, understanding the kind of deep, granular knowledge of a specific topic that can let you read an article that's just coming out and saying, oh, these are the strong points, these are the weak points, this is why it's really important, and this is why it's probably not accurate. That's really important. That's our lifeblood in public health, to be able to understand the path to progress in the formula, see, believe, create. Part of the see is not just see the threats that are coming, whether they're microbes like Ebola or toxins, but also see the pathway to progress. And that's what technical rigor is for. So that's the first important skill, data analysis. The second is effective communication, and that includes listening. Probably the biggest failure in COVID was our failure to listen, to understand what communities were seeing, hearing, willing to do, believing. Ironically, while the US was failing to do that, my organization, Resolve to Save Lives, was partnering with more than a dozen countries in Africa to do just that, with multiple rounds of surveys to understand what the public perceptions were and adjust public policy so that they would not lose the basically connection with the community. And the third, in addition to good data analysis and effective communication, is good implementation skills. This is a big challenge, and this is an area where, again, I talk about in the book, in the create phase of See, Believe, Create. What does it take to organize, prioritize, simplify, communicate, overcome structural barriers to progress in public health? And for implementation, there's nothing that beats working, trying, learning from people who have been successful, and learning from our own and others' failures, because we don't always succeed. Sometimes it can be very discouraging. We'll feel like a real failure, but the only real failure is the one you don't learn from. So learning from the challenges, learning from mentors, to learn that implementation skill. Data, communication, implementation. See, believe, create.
Awesome. And I think these are truly the foundational tenets of public health, especially in this time that we are in. I know most programs, do well with data analysis and perhaps, implementation science and some course in implementation science. As you said, I think one of the key areas that hopefully public health institutions will step up is in the area of effective communication, because we've seen how things are going downhill because we are not able to communicate or listen to the public that we are trying to protect.